10,000 jobs will be cut, according to RFK Jr. Put him up full mass. He is one of the biggest damn disappointments in this whole scenario. That's my opinion. RFK Jr. says 10,000 jobs will be cut because they have to restructure the U.S. Health Department. This will eliminate about 1 in 4 federal health agency jobs, HHS said. This will also consolidate 28 branches of the department into 15 new divisions, including the new AHA. Robert F. Kennedy Jr. said the nation's health agencies will cut 10,000 jobs from their 82,000 person workforce, an enormous reduction. The U.S. Health Secretary characterized as streamlining federal bureaucracy amid internal resistance to the administration's agenda. The cuts announced yesterday, along with previous restructuring and voluntary buyouts, mean the Department of Health and Human Services will lose roughly 20,000 workers. Kennedy said the department will also close half of its regional offices and create a new agency called the Administration for a Healthy America, or AHA. Quote, "We aren't just reducing bureaucratic sprawl. We are realigning the organization and its core mission and our new priorities in reversing the chronic disease epidemic," Kennedy said on Thursday. Now, remember, the branding of it includes the word America. This is a branding dynamic. They're not fixing anything. There is no overall strategy. There is no great plan. There are no experts. The Secretary of Defense doesn't know he's not supposed to use signal to communicate top secret information. They have no institutional knowledge. There is nothing. Trump isn't even briefed on this stuff. He doesn't know what the hell is going on. Elon Musk is squarely in charge. And they're continuing to cut all of these federal jobs, but they're not cutting your taxes. How is this helping for the cost of living? It's doing nothing. They're literally making you spend more with tariffs and everything else. So you're going to pay more. You're going to now get less because you don't have anybody there to answer the phones. But you've paid into these taxation systems to get these services your whole life. And now they're taking them away and giving you no reduction in the process and rebranding everything America this, America that. That's fine. But damn it, change the structure to a remedy rather than creating more of a problem. Here's what I believe is happening. All of these individuals are quite incompetent for the roles that they're in. They're incompetent because they're willing to work for Trump. I don't give a damn what qualifications they may have or not. If you're willing to work for Trump, you're incompetent because he's going to make sure that whatever your agenda is not yours. It's not your capabilities, your expertise, or what you actually want to do. It's what he wants to do. So they're shrinking the government. They're eliminating all of these institutions, killing the Department of Education, destroying the Department of this, getting rid of the Department of that, shrinking Social Security. Why? Because they're not equipped to deal with this enterprise at current level. So they're going to shrink it. They're going to do exactly what Trump did to the White House. He could never rise to the occasion of being president, so he had to shrink everything around him. And that's what they're doing. They're going to shrink this to their size. And then, in my opinion, Elon Musk, this whole Dodge dilemma, that's going to become privatized. And once it becomes privatized, Doge will have control over all of these governmental entities now under contract privately. This is the privatization process of America. That's my opinion. Kennedy said the department will close half of its regional offices to create the new agency. This is going to be insane. HHS is among the largest branches of the federal government, overseeing 1.7 trillion budget and agencies that are household names. Among the agencies under HHS are the Centers for Disease Control and Prevention, CDC, National Institutes of Health, NIH. They help us academically as well. They're being cut. The Centers for Medicare and Medicaid Services, cut. And the Food and Drug Administration, cut. How will this affect you? The critical work performed by these agencies includes protecting Americans from outbreaks and infectious disease at the CDC, helming the world's largest publicly funded biomedical and behavioral research agency at the NIH, providing health insurance to 137 million Americans through the public programs Medicare and Medicaid at the CMS, and approving and regulating the nation's medical devices, drugs, and foods, FDA. HHS said in a news release that the reductions will not affect drug or medical device approvals. Now, we already know how the administration works. It's not difficult to decode. When they say it's one thing, it's the opposite. So when they tell you this will not affect the medical or device approvals, that means it will affect medical, drug, device approvals, et cetera. So drug companies, medical device makers, and other industries, organizations, they pay something called a user fee. The user fee helps the FDA complete timely reviews of new drugs and devices. However, impacts on the timing of drug and device approvals may be unavoidable, said J.P. Leader, director of the Center for Public Health Systems at the University of Minnesota. A federal worker who is technically categorized as clerical or administrative could also be integral to delivering these services, he said. Cutting workers like that could indirectly impact drugs, medical devices, and food. Other workers may also have to double their workloads to compensate for cuts, which could slow down overall productivity. Quote, getting everybody into the same system means there will be slowdowns, end quote. Quote, that's just part of these changes. HHS officials did not immediately say how the changes will allow Kennedy to carry out goals of making the nation's food supply healthier. Because he doesn't have a damn plan. That's why. It's absolute no plan whatsoever. All right, Reece, thoughts here.
Well, first of all, this is, any media that's reporting this as a restructuring, this is a dismantling of our health infrastructure. The idea, like you said, that this is making America healthy again, when they are basically taking a buzzsaw to the healthcare infrastructure, ensuring that we do not make any progress in terms of our research capacities. Some of the things that are on the chopping block are research for pediatric cancer, for Alzheimer's disease. These are not controversial things. I know they want to throw trans out every other word, noun, verb, trans, to try to make people feel like they're cutting waste, fraud, and abuse. But the reality is that this is a full-scale attack on systems that are a matter of life and death, a matter of sickness or in health. And this can only be seen in the context of all of the other decisions that this administration is making as pruning the population. Now, all the people that sat up there and said, you ain't gonna shoot me up with the vaccine because y'all gonna be zombies in 2 years, and it was a big conspiracy about how that was population control. This is a conspiracy in front of our faces that y'all thought the COVID-19 vaccine was, because there is no way this is gonna make our country safer. And they're attacking every aspect. The food supply is gonna be less safe. The prevention is going to be practically non-existent. The attacks on research grants is actually an additional attack on educational institutions that are funded by these research grants. And so they are leaving no stone unturned on the way that they're dismantling it. And what makes it even worse is the centralizing that they're trying to do is to politicize it, and to your point, Dr. Richey, make it more profitable, whether that's through privatization of currently public services or in deregulating things in a way that makes us less safe, but it makes it more profitable for these corporations so that the Elon Musk's, Jeff Bezos, and all their other benefactors can see more of that profit and not have to be held accountable to keeping our country safe with the barest of standards. Because I don't think that we have the toughest standards in the world, but they've been enough to make progress in terms of our health, and this is not going to move us forward.
That's right. We'll stay on top of it to make sure you're informed.